Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. This is one of the most, shall we say, discussed items between you, the viewers, and us. I always tell you this is your program. And we're going to talk about valvular heart disease. But really the questions have always been about interventional cardiology. Minimally invasive techniques. It's probably next to the issue of cancer. Cardiac issues are right there relative to the people who watch, and they are so interested in interventional cardiology. Otherwise, in their minds, is minimally invasive cardiovascular techniques. So, I'm so pleased to see you, Dr. Gilberto Concepcion, who's sitting here. Thank you very much. And Dr. Pedro Valdes, DO, who is sitting here. They are both interventional cardiologists. Welcome to both of you.
Thank you, Dr.
Thank you for having us.
Okay. Tell the folks out here what an interventional cardiologist is, Doctor.
It's a specialist in the field of cardiology that deals with procedures treating heart disease, particularly the coronary arteries, which are the blood vessels that supply blood supply to the heart muscle. When these vessels become obstructed, us interventional cardiologists perform certain tests to first identify where the obstruction is, and depending on the location, the amount of vessels, we create a map and then decide what type of treatment is required. And one of the treatments that we provide is placing a balloon inside the vessel and expanding the obstruction, and subsequently maybe placing a stent, which is sort of like a little mesh inside the vessel to increase the diameter of the vessel and allow free flow of blood flow through the vessel.
Doctor, what do you have to add to that?
Just as Dr. Concepcion added, main thing is when patients come in, especially with emergency, someone has a plaque rupture in regards to have an acute infarction, our jobs are to relieve that obstruction, reestablish flow as soon as possible. And the stents that Dr. Concepcion were talking about act as a scaffold so as to maintain that vascular structure in place and also to ensure adequate blood flow distally to relieve the amount of ischemia or time lacking blood flow to that heart that's agonizing and hurting because there's lack of flow there. So as you have immediate relief of flow. But we do more than that. Besides being clinical cardiologists and now helping with the vasculature in regards to circulation, there's been a massive growth in regards to what we call the structural heart disease field, and that entails aortic valve disease, mitral valve disease, tricuspid valve disease, as well as what we call patent foraminal valley closures. So the field of interventional cardiology is ever growing, and on a daily basis there is not a trial that breaks that doesn't add to our armamentarium of new drugs and new procedures that we do.
You know what we hear from the viewers, and I always say this is their show, and that's why I want to talk about this. You know, we've had some, and we've been very pleased at the growth of our medical community here in South Florida. And we've attracted some of the greatest physicians really in the United States here, although I'm always very proud of the physician representation at the multi-hospitals that are in South Florida. But, you know, the whole issue of cardiac, shall we say, care has changed so dramatically. You must feel very, very, very pleased and very happy that you could be part of it.
It's very rewarding, and as you mentioned, the pendulum has swung from surgical revascularization or surgery treatment for coronary artery disease, and what we're able to do now in a mechanical way through intervention, minimally invasive, going through the groin or through the wrist, and opening up these vessels that years ago, perhaps maybe even 20, 30 years ago, would easily have gone and onto a surgical type of treatment, where nowadays we're very aggressive. We have much more armamentarium, as Dr. Valdes had indicated, that we're able to provide even a more aggressive, more comprehensive revascularization with equal or better outcomes than the surgeons. So the pendulum has swung. and the surgeons nowadays aren't doing as much in terms of bypass surgery because of, again, the advances in the interventional field.
But as Dr. Valdes pointed out, I mean, it has gone well beyond that, because now you're getting, valvular transplants and things of that nature, which you're all involved in, correct?
Yes,
Dr.
sir.
Valdes?
Yes, sir.
It is a team approach. This is not surgery versus interventional cardiology, but it is a team approach in terms of the care that we provide with the patients, with consultation, close conferencing with the surgeons, and determining what's the best treatment course for the patient. So it's not an adversarial relationship. And as you said, we build a good program there in terms of not only the interventional cardiac program, but also the surgical program. And we work in tandem, and it's a team approach.
And you also, if I'm not mistaken, there's a new foci for the interventional radiologist as part of your programs too, as well. I mean, they do some of the mapping.
The interventional radiologist on a regular basis, as part of, that's I call Palmetto, is a heart center of excellence. And I will hold Palmetto to anywhere in the greater South Florida area, as I believe, in my opinion, based on what I see on a day in, day out basis, we provide as good a care, if not better, than most every facility. And I would take you up on that, Dr. Lippman, anytime you want to take a first-hand look. In regards to interventional radiologists, they help with any and all procedures, whether it be peripheral arterial disease and vascular complications or vascular interventions that need to be done. But they're also part of that greater team in regards to what we are soon to hopefully start, which is a pulmonary embolism response team, which is a very small but yet ever-growing field as well, nationally. As an interventional cardiologist, the biggest emergency is always an acute vessel closure, an ST segment elevation myocardial infarction, as they call it, a STEMI. But nowadays, if someone comes in with a massive pulmonary embolism, those people used to just be given tissue plasminogen activator, or TPA, and wait and see. Hopefully they didn't bleed. They could die on you. But as we are now at the beginning cusp of forming these pulmonary embolism response team, PERT teams, along with the interventional radiologists, the interventional cardiologists, surgeons, and as Dr. Concepcion mentioned, work as a well-oiled team, we're providing even greater services to the greater South Florida and immediate Hialeah community. Well,
and also, I think it should be mentioned, even though it's not necessarily part of the cardiac care, but being certified as a certified stroke center,
yes, sir,
was a big step too. When they talk about minimally invasive techniques, which is in essence not to in any way, I guess you could say, dilute the responsibilities that you have, but in essence what they think of out there is that they want less cutting, less bleeding, and less pain. And that's when they talk about minimally invasive techniques. But here, not only do you answer all three of those questions, but even more importantly, now you're saving lives that have never been, well, I shouldn't say that. We've had some magnificent cardiovascular surgeons, work in the South Florida area. But the kind of work that you're doing now, and the fact that you have 13 interventional cardiologists, is really outstanding, and it must give you great pride to work together as a team.
And the satisfaction of being able to expeditiously provide care to patients that, as you mentioned, perhaps 20, 30 years ago, may have suffered heart damage because of the limited treatment that was available in terms of perhaps giving clot-dissolving medications. We didn't have perhaps stents before 1995. So there was limited capabilities for the interventional cardiologists to provide expeditious care and good outcomes. Nowadays, someone is coming into the emergency room with a heart attack, and perhaps in a very severe crisis, life-threatening situation, and we're able to rush that patient into the cardiac catheterization laboratory and immediately diagnose where the obstruction is, perhaps suck out the clot, put in a stent, reestablish blood flow, and presto, you've got a saved life and a person who you've preserved the muscle of the heart, and the limitation or disability thereafter is limited or nil.
And I take great pride in doing these programs because all I'm trying to do is try to provide information to these people to make their lives healthier. So I just want to let you know how important it is.
Thank you, sir.
And the message that I would always tell patients is we can do our job, but you have to identify that you do have a problem and seek help immediately. A lot of patients sometimes stay home, they sort of mitigate their symptoms, or they make excuses. They might think it's gastrointestinal, or there may be a soreness in a muscle in their chest, and time is of the essence. So it's incumbent upon patients to identify that perhaps their pain may be of cardiac origin and seek help quickly, because then we can do our job efficiently and save the life if need be.
Doctor?
To Dr. Concepcion's point, the main driver of interventional cardiologists is also when we are able to relieve chronic or acute blockages, is we provide significant symptom relief for those patients. Those patients are now able to go about their daily lives, whether it be the next day or 2 days later even, with a small dot on their wrist, no significant bleeding, no significant discomfort. They go about their active day-to-day lives without significant shortness of breath when they're exerting themselves, without significant chest pressure or chest pain. They're now able to enjoy chasing around their grandkids. They're now able to enjoy, as that UPS driver was, running around, picking up his boxes, enjoy his day-to-day living without having to think, is there something wrong with me? Do I need to see a doctor? Is this an emergency? Once we know what's going on and we can treat it, there's symptom relief. It's immediate relief of symptoms. And for your patients, when you see them a couple of weeks later, oftentimes in the office, say, I'm able to do everything again. I'm back to my normal lifestyle. But there's a caveat. The caveat to that is, I do my job, but the patients themselves, the population, has their responsibility. They need to stay active. They need to walk 30 to 45 minutes daily. They need to eat a lot more vegetables, fruits. Keep away from the processed foods. And that is my battle with my patients is a constant education that needs to be provided to them. Because if you don't provide that, your procedure will last, but they're going to reaccumulate further blockages at much more aggressive rates and advanced rates. So it's everything we also do outside of the actual procedure.
I'm glad you brought that to this conversation, because I know that we're talking about valvular heart disease and interventional cardiology, but it really is up to those folks out there. And we have a lot of people that watch us. A good number of our people are mature and or moms and dads that are home and they watch these programs. And I every time I have a cardiologist of some sort in front of me, the one issue that you just brought up is the thing that I was going to bring to our conversation. Because people, I know, when you notice that people you get so many ads on television and you're eating so many, and it's okay, there's so many processed foods and they don't know what they're eating. I understand, it's tough sometimes, working man and woman that are out there and they work all day and they go, so they run out to a fast food operation and they get what they get. And I'm not knocking them, but the bottom line is that it's the same problem that you have when you're walking through a supermarket. I mean, how many people read labels?
Zero. Well, not zero, but very few. You need to be much more educated. And that's, again, as a physician, you're in a position where more times than not, your patients are looking for you for direction, looking at you for advice. And in my position, I try to lead by example. I'm in the gym regularly. I try to eat well. But I also tell my patients is I don't want you to make excuses. You have a job now. You have to take care of yourself. And part of that is you need to live a certain lifestyle. As most of your cardiovascular literature will say, is there's lifestyle modifications that need to take part in order for us as a whole, as a society, to live much healthier lives. But it is our duties as physicians to constantly put that message out.
And the one thing that is always touched on by the cardiology teams, the various entities, is the issue of how much water do you drink in a daytime? I mean, for some reason, people just don't hydrate. And tell me, you tell me, I don't want to get into it. You tell me, Dr. Concepcion.
Oh, I think that's a big problem. I think that patients in general, or not even patients, us humans in general, are so consumed with daily activities and work that we forget to hydrate ourselves. So we're clinically hydrated, and that takes a toll. That takes a toll, particularly at the kidney level. Listen, over 70% of our body is based on fluids and water. So you need to hydrate. You need to replenish that fluid that you do lose during the day, even just from simple breathing. So it's important to at least have 8 fluid ounces of or glasses of water per day. And again, in a sequential manner throughout the day. This is not gulping down 6 or 7 glasses in one shot in the morning, but throughout the day, you really need to go ahead and hydrate yourself. And also, particularly if you're exercising and you're exposed to the elements of heat outside, etc., that will increase water loss, and you need to replenish that. But no doubt about it, that's a major problem you identified.
With reference to that, I mean, it's just, I usually don't bring in any personal issues, but I had a family member that woke up, during the night to go to the bathroom, whatever, and they would stumble. And until finally the doctor said, if you don't, you got cardiovascular hypotension. I mean, you're lying down and you're urinating out your fluids, but you're not replacing anything. So you better make sure that you drink, go to the refrigerator and drink whatever you want. He happened to recommend taking some products which has electrolytes in it as well as water. And it never happened again.
I'm completely with them. Most of, as our patient population gets older, the ability and just to remember drinking frequently, it diminishes. The most common cause of dehydration, or the reason that I see for my patients in the hospitals, they come because they've passed out. They get up abruptly, they're dehydrated, their blood pressure falls, and before they know it, they find them on the ground. So it's paramount to increase fluid intake. In regards to how much, it differs for everyone. If you're someone who's younger, you're outside, it is hot, it is humid, it's South Florida. We have 2 seasons, hot and hotter. It doesn't ever really get cold out there. You need to constantly replenish fluids. And back to the point of nutrition, electrolytes are important. But when we say fluids, I'm talking about water. I'm not talking about juices, Coca-Cola, or sugary processed drinks, because that's also a problem too. With the amount of overweight, diabetic population that we have exploding in these communities, it's consumption of those other manufactured products that also don't help you hydrate, and they lead to worsening diabetes that ultimately leads to worsening heart disease. Things to know.
And some patients are actually being treated with diuretics for hypertensive disorders, and obviously they have an increase in water loss, and so they need to be more mindful of replenishment of fluids in water. So it is a problem, and also to the point of compliance. Medication compliance is a big issue, and us in the interventional field, when we put a stent, we require that patients are on dual antiplatelet therapy. In other words, medications that sort of thin out the blood. And it is of paramount importance that these patients comply with this. Otherwise, these stents can clot off and bring about a heart attack and perhaps near fatal situations. So it's important, as Dr. Valdes said, to educate your patients in terms of lifestyle modification, but also compliance with the regimen that has been implemented in terms of their medical treatment.
Well, believe it or not, we're down to the last 4 minutes of this show. And I'm really, really very happy, and actually I'm thrilled to have you both here because, like I said, the folks out there are very, very into letting us know what they'd like to know about. And like I said, cardiac disease and cancer are the two number one. They're almost tied. They want to know more about it all the time. But right next to it is an issue which has nothing to do with the disease. It has to do with technique. They talk about minimally invasive techniques, and they talk about stents and things of that nature. So you're here at the right time because they wanted to hear what you had to say. But I just want to sort of top this off with your statements. Dr. Valdes, you've already made it very clear that you're talking about nutrition, hydration, et cetera, exercise. You mentioned something, and you talked about walking. Walking is very important, isn't it?
Yes, sir. And it's not, as I tell my patients, don't grab your phone and start talking to mom, pop, or Joe on the phone and think that that's half an hour or 45 minutes of exercise. No. Do yourself a favor. Put a little headphones on, put your favorite music on, and dedicate 30 to 45 minutes every day at raising your heart rate and making yourself work a little bit. If you don't invest time in yourself, disease will invest time in you. You're eventually going to get sick. And then by that time, me as a physician, I haven't helped you. I help you at the most when I can prevent problems from occur. We're all going to get sick. The majority of us will suffer from some form of coronary artery disease. But if we can take the onset of that disease and push it as far out as possible, then we're making progress.
That's a brilliant and wonderful comment. Thank you. It's very good.
Thank you, sir.
Dr. Concepcion, it's all yours. You're cleaning up this show.
Yeah, I second what he just mentioned. And patients should indulge in brisk walking to increase their heart rate. And emphasis on lifestyle modification is key. There's a lot of patients that incurred coronary artery disease or blockage in the arteries by way of cigarette smoking. And that is a major risk factor. And that's something you can easily control in terms of cessation. Stop smoking. Once you've got disease, you're a cardiac patient for life. You need constant scrutiny, constant follow-up, but the patient also has to contribute in that overall care plan in terms of following the regimen implemented by the physician or the treating physicians and partaking in exercise, eating well, and avoiding bad habits. And that leads to a better lifestyle and better outcomes in terms of longevity and feeling better.
So take good care of yourselves. That's what I always tell them. Mm-hmm. Thank you, Dr. Gilberto Concepcion, interventional cardiologist from Palmetto General Hospital. And Dr. Pedro Valdes, thank you, sir. DO. Where were you educated, by the way?
I actually spent some time on this campus. I spent some I did my undergrad at Barry University as an exercise science, exercise physiology major. I did all my pre-medical prerequisites here at Nova Southeastern University. And medical school, spent some time in Blacksburg, Virginia at Edward Via College of Osteopathic Medicine.
Right.
Yes, sir.
Well, good to have you back.
Thank you, sir.
You're both always welcome at Nova Southeastern, you know. And of course, now we have a DO and an MD program. We're only the third university in America to have that. But Palmetto General has always been a primal, very early participant in helping the College of Osteopathic Medicine evolve. So thank you both for being here. Folks, if you have any questions, you have any comments, there's an email address right here and a telephone number. Just give us a call. We'll get the calls to these wonderful people. And if you remember, as I tell you always, you got to take good care of yourself. But in taking good care of yourself, you got to see the doctors and don't hold things back. You know, if just like Dr. Concepcion said, well, you know, I had a little strain or whatever, tell the doctor. What's the worst thing that can happen? The doctor says, you know, or maybe we ought to see a cardiologist, or maybe we do an EKG, or maybe whatever. I'm not playing doctor, but you got to take good care of yourself. So remember, this program is called Dateline Health. We come to you from Nova Southeastern University. I always tell you, take good care of yourself. My name is Fred Lippman. Until next time, see ya.